In 2017, I started working on a passion project. I saw the challenges that physicians have with using their computers, and I thought, why can't I maybe make something that helps them do their jobs better? So it started simply by me interviewing physicians, asking questions, researching the things I didn't understand, and beginning to piece together a view and understanding of how a physician's day-to-day and how practice works in general. Through the last 7 years, I've gone through many designs and prototypes and ideas and iterated to a point where I think I have a pretty good understanding of how to build something that can make a physician's life easier. Today, I want to tell you a little bit about what that is as kind of a pseudo, not necessarily marketing, but I want to help you understand because I think it'll be a good exercise for me. So if you're willing to come along with me, I'd like to give you an in-depth look at how this thing works. This is essentially a view of the current world. Now, this is not completely representative of every single system, and it's also not representative of every practice, but in general, this is roughly how most of these things work. Inside the EMR, we have things like care delivery, care governance, revenue cycle, practice management, and clinical decision support. These are things that basically help doctors do their job day to day and a few back office tooling. Not every EMR has these tools like practice management, revenue cycle, but many of them do, and it's becoming more and more popular for them to be integrated together. Those things are great, but in addition, there are often other things that happen outside of the EMR day to day, particularly if it's a smaller practice. Things like website marketing, hiring, email, phone calls, other appointments and calendars. Billing is sometimes part of revenue cycle, sometimes it's not. HR, all of these types of things kind of live kind of in this ethereal cloud of other tools and other things that a physician might need to be using. The problem is that they're not very well integrated. They're in different parts of the product or they're in different areas and different features that may not be intuitively linked together to help people actually do the job that they're trying to do. So when I think about, and having talked to lots of physicians, when I think about what they want, they're thinking about taking care of patients effectively. They're thinking about wanting to have workflow efficiency. They want work-life balance, and they want to get paid in order to actually make a living. And in addition to that, then you also have things when you have practices or hospitals that actually use these things, they actually have some pretty big pain points in terms of like implementation being a huge difficulty and painful process. These systems can be quite expensive to run and operate. They generally are one size fits all at the lower end of the market, and at the upper end of the market, when they are more customizable, it's often months and months and months of customization time in order for them to fit the particular workflow challenges. And they're generally slow moving, not just in terms of implementation, but in terms of updates and things like that. Now, this is not an advocation for build fast and break things in terms of healthcare, but I think there is a bit of a disconnect there between how long it takes to actually get things implemented. Now, what my proposition is that healthcareOS is a system that allows for the integration and when I say integration, I mean more of a UX and kind of design integration of these features together. So things like billing and revenue cycle kind of link together. Patient engagement, patient intake kind of link together. Care delivery and even like calendaring should be more linked together than they currently are in a lot of systems. While this is all well and good, and this is kind of where the operating system piece of this name comes from, it is still a bit of a challenge to figure out exactly how do we help this go? Because a lot of these systems propose to do that. They are saying, hey, we do all of it. We do it all in one. And that's expensive to build. It's time consuming to build. And it's a huge risk for a company to try to come out of the gate building all of this. So how do we actually make it something more simple to implement and potentially simpler to understand? So let me show you a little bit of that idea. So my proposition, and what I've done when I've been doing this research around the design ideas for this, I stumbled into this area of research called itemized operating systems and things for maybe a computer or your phone or a tablet. And the goal with these systems is to integrate different tools together into kind of unified views that allow the user to flow between things that they need to do. So for instance, if you're writing a research paper, you might have your docs editor, you might have a browser tab, and you might have something like other PDFs or things that are on your computer. And you might want to be able to see all those things in line so you can quickly and easily navigate between them to do what you need to do in order to write your paper. You could think of something similar for scheduling an appointment where you might have your calendaring, you might have a maps, you might have your messaging or your email in order to kind of understand what is my availability and where can I go and how can I get there. Those are all kind of examples of how they might work at the computer level. But inside the electronic health record, or inside the physician's computer level, if you will, there are lots of things that could be integrated together a little bit more easily. So an appointment view, and this is where I kind of start thinking about space. And these spaces are essentially the aggregation of a lot of these different tools or tasks. So these tasks are things like a noun plus an action. So I'm going to visit with a patient is an appointment. A chart review is a recent visit of a patient, right? So these are things that we can see and find logically in the database, and then we can assemble them into a kind of chronological, or really however the user wants to see in that kind of view, so that they can get into it. Now, in the Launchpad view of healthcareOS, these spaces are represented by these kinds of big cards over on the right, and these cards are designed to give you kind of an overview of what's in that space, right? So inbox, charts to review, prescriptions, maybe these are outstanding, or maybe requesting a refill. It could be results. So all of these spaces are things where it's like, this is a thing that needs action, basically. That's what we're getting at. And the appointments is basically a pin space. This is a particular space that could be dragged over. Maybe is that the interaction decides that it can be dragged over, and then the user can get to it there. And that's kind of the goal with this, is that this kind of gives you the launching point for getting into these spaces. Now, these spaces are made up of items, and these items are the things, basically the nouns inside of these spaces. So these items right here, so this is an appointment. So this is Priscilla, right? This is a patient. This is the first patient. This is a patient that you need to be seeing right now, right? And these spaces, or these items, can be kind of whatever. So they could be people for an appointment. If it's a chart review, it would probably still be people. If it's an inbox, it would be, an email message, right? And basically the goal is that within these items, they have flows, and these flows are a series of modules. And I've talked about these modules before, but the modules are essentially the itemized view of all of these disparate tools that we were just talking about. So all of these tools, all of these things, which can be represented here in a very, very brief list, all of these things are represented by modules. And so these things that would typically be features or different pages or different menus are actually just these little modules that can be assembled in whatever order and can be searched for and maybe even pinned depending on the organization. So the flow basically has an item with module, 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 right? The physician can come in here and say, okay, I'm looking at Priscilla. She's got these things. Let me go and look at her active conditions. Oh, I see she's got diabetes and hypertension. Maybe there's something related to that. Let me go and look at those. And you would see the module for both of those here kind of represented maybe something like this. And you would kind of get this row of modules essentially. So the idea then is, once you're ready to do something, right, you go into a deep view. And this deep view is essentially a view of doing something. So this could be something like this, where it's like, okay, I need more information. I just need to get in and see all the nitty gritty. Okay, let me expand this out and see all these things. It could be note-taking. It could be an intake flow. It could be a number of things, could be this deep view. And the goal being that this is kind of not a transient thing, but it is attached to this workflow. It is attached particularly to this workflow, particularly to the noun and action, which we could easily kind of understand based logically, right? So if it's an appointment and you have a certain level of access, then you can only do an intake with this patient. You can start that deep view, and that deep view, your deep view of this patient, is different than what the physician sees, which might be a note. Or if the intake hasn't been done, then the physician can do the intake. Now, why does all of this important? Because I think what a physician deals with, they deal with so much chaos day to day that this is essentially what they need to work through. And this is not any like, I don't have any deep psychological background. I haven't done any of that. This is just kind of my intuition based on my chats with physicians and reading different papers and studies about what's going on. At the top level is orientation. This is essentially the user asking, what do I need to do today? What are the things that have changed? So often I talk to physicians and they go, I need to see what my new most important emails are at the beginning of my day, or I need to see what my first patients are. I need to see if I have new patients. Maybe they come back from a break, they come back from lunch, they come back from a meeting. Are there things that are different than when I was here last? That's essentially the goal. And that's what the Launchpad is designed to do. It would highlight and maybe even call out things that are slightly different than the last time you logged in. identify what should I focus on and how should I focus on it. For most physicians, this is going to be appointments. So it makes sense to make that the most important thing, but it could be inbox. It could be maybe even a priority inbox. And this could be something that, that they need to focus on, right? They need to go and say, okay, I need to check my messages. I need to see what's important. Have I gotten new messages from patients? Oh, I remember I was following up about that thing. Let me see if I've gotten a message about that back. Things like that. And then the discover step. This is essentially, what is my next step? What information do I need to take action on? This is going into the space itself and saying, okay, I'm ready to go into an appointment. Let me see, okay, my next appointment, Priscilla, okay, great. She's in this room. She's here. Jerome, he's not here yet. He's not roomed yet, but he's checked in. I know what I need to do here. Let me review their thing. This is essentially the pre-consult phase. What information do I need to take action on? So this could be looking at the chief complaint, this could be looking at the active conditions, and potentially even then having actions there. And this is something that's not represented in this design, but having actions like add this thing to the visit today so I can make sure that I'm going to do it. Add these details there, or open, they're here for a follow-up on something. That's a recent event. Let me go ahead and open that. And we know that in the system, this is just a logical thing that we would know based on the timeline of the inputted information, that we can then pull that up for the user. And then decision making. This is the core thing. This is the very bottom, and this is essentially like the focus mode of the physician. What do I need to know to make a decision? How do I document that decision? And this is going into a deep view, potentially even going between these types of modules and a deep view. And again, this deep view might not be the best example, but you could feasibly think of something here like, documentation, and making orders, creating plans. All these types of things could be in this view so that a user doesn't have to go into all of these different areas. They don't have to do different things. And importantly, even if they're in a deep view, they can still access other modules. They can still access other information. And if we were to show, a medication here, that medication view would be the exact same as the medication view that comes up right here. It would have the timeline, it would have the pharmacy, it would have the connected condition or diagnosis, it would have relevant actions, changing dose, deleting, refilling, whatever it is, all those things could be in there right in line. So this is my vision, I guess you could say, of what the future of an electronic health record could be. Are there lots of problems with it? Absolutely. The first one, this is so big. There's so much to build here. There's so many things that would have to go right. And more importantly, it would be a big challenge to even onboard users into this. And this is one thing I'm focusing on this year because I want to simplify a little bit of this. I don't want to remove the core competency here, I think, which is these flows, but I want to create a little bit more of a constrained experience for early users to guide them into why this flow might be the best UX. And for me to learn whether or not it actually is the best UX. That can be a big problem. If I get them in here and they have all of these things, it might be a little bit too confusing. Whereas if I were to get them in here and say, okay, you have appointments, you have messages, and you have action items, for instance, then that could be a good enough mental model for when they start going, I'd really like to have a dedicated area for results. Okay, let's introduce a way for you to build these kinds of spaces by yourself. And maybe we give you a preset list in the beginning, and we kind of piecemeal you into that experience, and I can understand whether or not that's actually a useful experience for the user. So this was a lot. There's a lot in here, and I'm very excited about it. I love working on this. I think it's really interesting, and I'd love to hear your thoughts. If you think this is wild and crazy and super out there and just it would never work, please let me know. I'd love to hear about those opinions. And if you're a physician or if you're in some kind of practice and you are really interested in this, I'd love to know that too, because I'd love to talk to you. Don't want to sell you anything. I just want to talk to you about whether or not it would be useful. Thank you for watching, and I'll see you real soon.